So this is Coviself COVID-19 Rapid Antigen Test. It's a self-test kit from Mylab. Download Mylab Coviself app to perform the test. Get it on Google Play or download on the App Store. So scan here for a video demonstration of testing procedure. For iOS, scan from a normal camera, and for Android, scan through any QR code scanner app. The net content is pre-filled extraction tubes 1, test card 1, instruction for use 1, sterile nasal swab 1 and disposal bag 1. MRP is Rs 250. So let's open this one to see what's inside. Before opening it, make sure you wash your hands properly. This is the pre-filled extraction tube. This is the disposal bag. This is the sterile nasal swab. The specimen collection swab is sterilized by ethylene oxide gas. This is the test card. And this is the instruction manual. So download and install the Mylab Coviself app from Play Store. Open the app and fill in the credentials. All fields are mandatory as per ICMR guidelines. It is an in vitro diagnostic test for the qualitative detection of COVID-19 antigen and nasal swab specimens directly from individuals with or without symptoms or with other epidemiological reasons to suspect COVID-19. This test is authorized for non-prescription home use with self-collected nasal swab specimens from individuals aged 18 years and older or with adult collected samples from individuals aged 2 years or older. I bought this kit through Apollo 24/7 app and got delivered within 1 hour. So I really recommend you all. Now open the pouch containing the test device, that is the cassette. You can store the testing kit at room temperature in a place out of direct sunlight and out of reach of children. Do not freeze any of the test kit components. Do not use the test device and reagents after the expiration date. Scan the QR code on the cassette to link the code with your credentials. Now open the pre-filled buffer tube. Extraction buffers, sometimes referred as lysis buffer, is a buffer solution used for the purpose of breaking open cells in molecular biology experiments that analyze the compounds of the cell. Now open swab package from tail end and take swab out and make sure you do not touch the swab head. Now tap the pre-filled buffer tube vertically on the horizontal surface to make sure that the extraction buffer settles at the bottom of the tube. Now insert the sterile swab into one nostril up to 2 to 4 cm or until resistance is met and roll it 5 times inside to ensure that cells are collected, and repeat this process for other nostril to ensure that an adequate sample is collected from both the nasal cavities. Withdraw the swab from the nasal cavity. Unscrew the cap of the pre-filled buffer tube and hold it in your hand safely. Make sure do not spill the content of the tube. Now dip it in the pre-filled extraction tube. Pinch the tube at the bottom and swirl nasal swab 10 times, ensuring the swab is immersed well in the extraction buffer. Break the swab at the break point. Discard the remainder of the swab. Mix well. Cover the tube with attached nozzle cap and tighten the lid. Add 2 full drops of extracted antigen buffer mixture into the sample well of the test device by pressing the tube and wait for 10 to 15 minutes for the results to appear. Results that appear after 20 minutes are not valid. Positive result. If both the quality control line C and the detection line appear, novel coronavirus antigen has been detected and the result is positive for antigen. All individuals who test positive may be considered as true positives and no repeat testing is required. All test positive individuals are advised to follow home isolation and care as per the ICMR and Ministry of Health and Family Welfare protocol. Negative result. If there is only a quality control line C and no test line T, it indicates that the result is negative. All symptomatic individuals who test negative by RAT should get themselves immediately tested by RT-PCR. This is especially important as the RATs are likely to miss few positive cases presenting with a low viral load. The Coviself COVID-19 rapid antigen test is an immunochromatographic nitrocellulose membrane assay that uses highly sensitive antibodies to detect COVID-19 nucleocapsid protein from nasal swab specimens. The test assembly consists of COVID-19 antibodies immobilized on the membrane as test line and a control solution of specific antibodies immobilized onto the membrane as control line C. Beside this, the test grip also contains a buffered sample pad with COVID-19 colloidal gold conjugated antibodies. When the sample, that is specimen and lysis buffer mixture, is added to the sample pad of the test device, the sample migrates along with the colloidal gold nanoparticles. If the sample contains detectable levels of COVID-19 antigen, then it reacts with the colloidal gold conjugated antibodies to form AGAB complex. This complex then migrates to the membrane and reacts with the coated COVID-19 monoclonal antibodies on the test line to form a test band. Irrespective of the presence of COVID-19 antigen, a colloidal gold conjugate antibody from the sample pad still moves ahead and forms a complex with control solution specific antibodies to form the procedural control line. If the quality control line C is not observed, it will be invalid regardless of whether there is detection line T. All RAT negative symptomatic individuals may be treated as suspect COVID-19 cases and are advised to follow the ICMR home isolation protocol while awaiting the RT-PCR test result. Swab is inserted in the lysis buffer tube which kills COVID-19 and other viruses. From the point we are exposed to COVID-19, it takes up to 14 days for symptoms to show. The viral load is highest between days 5 to 7. This is when you are most infectious. Anything outside of the 2-day infection window where the viral load is highest, the self-swabbing kits have a higher chance of false positive and false negative results. Take the device and click the picture. Wait for the app to analyze and display your COVID-19 test results. Now take the picture of the cassette with test results and upload. This tube with broken swab head inside along with other component of the test should be put inside the disposal bag and thrown in the household waste. Disinfect all surfaces that the specimen may have touched and wash your hands after disposal. Thank you everyone for watching it. Do like, share and subscribe to my channel and see you soon in my next video. Everyone stay healthy, stay happy.